Animal extremist questions us why animals are made to suffer for a problem that people inflict on themselves. To put forward more science into this area, we have a final resource person from God's own country. She has graduated from GMC Kottayam and Trivandrum, has completed basic and advanced course in medical education with an overall teaching experience of more than a decade in GMC Kottayam and Alapi. She is also an able administrator. To enrich her credentials, she has obtained a couple of best paper awards and published 31 academic papers in various peer-reviewed journals, holds membership in National Pharmacological Society. Current interest is in the research related to phenytoin adverse drug reactions and polymorphism. Before you all leave the meeting, shall we go by the name Dr. S.P. Danya, Associate Professor, Government Medical College, Kottayam, to educate us on the comprehensive review on the screening models of drug addiction. Danya, ma'am.
Good afternoon, everyone.
You will be sharing the screen, ma'am?
Yes, sir. But has Ashok sir stopped screen sharing?
I'll stop my screen sharing. Yeah, yes, ma'am, you can share your screen. Participants, one second, ma'am.
Can you
Yes, ma'am, tell me, ma'am.
me as a presenter?
Akansha? Yes, ma'am, one second.
Yes.
One second, ma'am, one second. Yeah, ma'am, I have made you the presenter. Danya, ma'am?
Yes, ma'am. Can you see the screen?
Yes, ma'am. Screen is visible. PPT? Yeah, of course, ma'am. PPT is also visible.
Yeah. Good afternoon, all. At the outset, let me thank Bhuneshri ma'am and her team for having me invited to present this topic. This is a comprehensive review of the screening models of animal models of addiction. I'm Dr. Danya, and actually I'm an assistant professor. I'm a CAP associate professor at Government Medical College, Kottayam. So we will be dealing this topic under the following headings. Why do we need animal models? What are the animal models that are available? The latest development as well as summary. So the first question itself is, why do we need animal models and why different models to study addiction? The literature says that there are about 30 million chemicals in the world, and of that, 300 chemicals produce addiction. We know that the profile of the drugs which cause addiction is variable. It can range from those drugs which cause sedation, like the benzodiazepines or the opioids, or it can range to stimulants like amphetamine. Similarly, some drugs like alcohol can cause physical dependence, while other chemicals like cocaine does not cause physical dependence, it just causes psychological dependence. Now, each of these animal model, they produce out the same results, the same drug, the same dose of the drug, the same site of action, but yet we need different models because these models give a crucial insight on what are the behavioral aspects of addiction, what are the habits associated with addiction, what are the neurodevelopmental as well as cellular mechanisms involved in addiction. So that is why we need animal models and different animal models to study addiction research. Actually, we have to get an integrated report from all these animal models because there is no single model to predict addiction. And one more thing is that the forward translation, that is the discovery of drugs based on this animal model, is very less. A few exception is the development of varenicline, of course, for smoking cessation, and naltrexone for the treatment of alcohol. So the forward translation and the positive predictive value associated with these animal models of addiction research is very less. But yet we have animal models. So before going into the animal models, we need to know what is addiction. And we all know addiction is a chronic repeating disease, and there is a cycle of addiction. It, of course, starts with initial drug use. It could be a peer induced drug use, or it could be just because of some interest or just for trial. They start on drug use, and then there comes the actual drug use and the drug. Excuse me, ma'am.
और छिपकली और छिपकली वो खिड़की से जरूर
Can others please move?
Yes, ma'am. I'm mute. Carry on.
Yeah. So there is the actual drug use and the drug-induced high that is caused by dopamine. And eventually some people stops the drug use, that is called as tipping. And then some people develop this binging of drugs, which leads to compulsive drug use, and then the opponent process trap, which is associated with again binging, the compulsive drug use, and the opponent process trap, which sets in the withdrawal of the drug.
Danya, ma'am?
Yes, ma'am.
There's a query that slides are not moving. Participant, is it moving? Slides are moving? Are you able to see? Participants? Are the slides moving? Is that fine? Yes, ma'am. Yes, ma'am. Carry on. Sorry.
Okay, so currently we are on the slide of cycle of addiction. Can you see that? Is
Yes.
it okay?
Yeah,
Yes.
yes, ma'am. Fine.
Okay, so the cycle of addiction, the initial drug use, the actual drug use, then some eventually stop, then binging, compulsive, and opponent process trap. So in this particular session, we will be dealing with the various animal models which are modeled on this cycle of addiction. So the various animal models of addiction, particularly I have taken from this article by Gardner et al. In animal models of addiction. So there is a pre-existing vulnerability for developing addiction. Then self-administration of the addictive drugs, intoxication and the drug-induced high, moderate versus extended access, compulsive drug use, the opponent process trap, as well as the animal models of relapse. So one by one, let us see each of those models. So there is the pre-existing vulnerability to develop addiction. So the pre-existing vulnerability to develop addiction. You might be wondering why only some people develop addiction, or why are we prone to addiction? That is because of the reward deficiency. And what is this reward deficiency? Reward deficiency just means that a person is not able to get the normal pleasurable activity while doing his normal daily routine activities. And how can we assess that? Which is the neurotransmitter associated? Yes, maybe you are guessing, and that is dopamine. So there is a dopamine deficiency in people who are prone for developing addiction, and we can assess it by PET scanning with the help of gamma rays, which are emitted by dopamine specific ligands, raclopride and falipride. So raclopride is C11 and falipride is F11. So with the help of the gamma rays emitted by dopamine specific ligands using PET scanning, we can assess that. Yet another mechanism for identifying the reward deficiency is the microdialysis. So in an animal with a brain microdialysis implant is placed, and there is a perfusate, that is artificial cerebrospinal fluid is injected via the implant, and through the output, we get the dialysate, which contains the chemical neurotransmitter. And this output is connected to an HPLC, and we detect the amount of the chemicals. So the two methods are, one is PET scanning and the other one is a in vivo implant of a microdialysis unit. Another method for determining whether a person is prone for developing addiction is the reward delay discounting. Imagine that you are a school going student. Okay, still you are a school going student and you have to do lots of homeworks, and your father says that if you complete your homework today, you will get a chocolate. He also gives another option. If you are going to complete your homework daily for the next 1 year, you will get a bicycle. So you don't have a bicycle, and your father is not like is not like current generation father who already buys you a bicycle while you're 2-year-old. So you have to earn that bicycle. I'm talking about that generation. So imagine that. So how many of you would go for the chocolate and how many of you would go for the bicycle? So I am actually introducing the concept. There is an immediate small reward. You can see the animal here, and there are two outlets. Through one outlet comes the immediate small reward, and through the other outlet comes the delayed large reward. The animal has a choice between an immediate small reward or a delayed large reward. So, like human beings, there are animal impulsivity in animals also. That is impulsive action. Impulsive action means the animal is not ready to wait for the delayed large reward, and it opts a immediate small reward. So what happens? There are high impulsive animals, and what do? They go for delayed large rewards. But studies with acute and chronic studies with cocaine, they show that acute and chronic cocaine use can decrease the impulsivity. So delayed large reward, uh, they are extremely averse to delayed large reward, but with time, with acute and chronic use of cocaine, there is decrease in the impulsivity. They learn to wait for delayed large reward. However, in animals who are having low impulsivity, they are low impulsive. So they do not get the immediate small reward initially, but what happens is that the acute cocaine addiction has not caused any change in their impulsivity, but with chronic cocaine use, there is an increase in the impulsivity, and they immediately try to get the small reward. So this animal model shows that it is only predictive of the initial addiction prone activity of the animal or human. A lot of factor is involved in the continuation or the outcome or the evolvement of the addiction process. So the next is the self-administration model. So self-administration model is the major model that is associated with addiction research. It has been done several times, and you can see here the animal is placed in a chamber and it is trained for a reward. So the animal has to push the lever and it gets a reward in the form of food. What happens in the self-administration phase? In the self-administration phase, the animal knows that it has to push the lever and it obtains either the drug or the placebo. Now, the pushing of the lever is called the instrumental response, and the consumption of the drug or the self-administration of the drug is called as consummatory response. And we have several routes of administration of the drug. It could be oral, it could be intragastric, intraperitoneal, intravenous, intracranial. A vaporized form of ethanol has been administered, and the animal pushes the lever once and it receives one dose. That is called as a fixed ratio reinforcement. Or the animal pushes 5 times and it gets one dose. That is again a fixed ratio reinforcement. Every time the animal is performing the same way, it gets a dose. That is a fixed ratio reinforcement. What happens in progressive ratio reinforcement? So in progressive ratio reinforcement, the animal has to press the lever once. So how many injections would it get? 1. If the animal presses the lever twice, it would get 2 injections. If it presses the lever 4 times, it would get 3 injections, so on and so forth. So there is an incremental increase in the work done to get the drug delivered. Usually it is not that steep. And what happens? A point is reached when the animal no longer tries to obtain the drug. The animal's response fall below some criterion, and that is called as the break point. And break point of a drug is indicative of its rewarding activity as well as the reinforcing activity of the drug. So coming to the third model. So that is the intoxication and drug-induced high. In the addiction cycle, you might be remembering there is the intoxication and the drug-induced high. Now, several studies have identified the areas associated with addiction, and they are the descending medial forebrain to the ventral tegmental area. Then we have the ascending ventral tegmental area to the nucleus accumbens, as well as the nucleus accumbens to ventral pallidum. These tracts are mainly involved in the process of addiction, and the neurotransmitters mainly released, of course, we have the dopamine. We also have GABA. Excuse me. Yeah, please mute. Dopamine, GABA, substance P, and enkephalins. So, what are the animal models? So, Gardner et al., they did experiments in the non-human primates, and they depleted and repleted the neurotransmitter. So, they serially depleted the neurotransmitter, and they also repleted the neurotransmitter based on an operant task to receive electrical brain stimulation. That is by the placement of intracranial microelectrodes and microcatheter. They depleted and then eventually repleted the neurotransmitter, trying to identify which were the neurotransmitters involved in addiction. And why is animal research important in non-human primates? We all know rodents and mice, they have short lifespan. As compared to the non-human primates, they have longer lifespan, and hence we can study the long-term effect of self-administration of the drug. Another thing is that there is a hierarchical variability based on the gender also. For example, the dominant monkeys who are males, they are found to have higher dopamine receptors in the brain. So what will be their characteristic? They will be less prone for addiction. However, it is the non-dominant female monkeys who have higher dopamine receptors in the brain. Hence, female monkeys would be less prone for addiction if they are non-dominant. So, a lot of opioid research is also associated in the non-human primates. However, because of the deaths of primates in a nicotine study, the FDA had to stop some studies in the year 2018 because of the deaths of the non-human primates. So we were studying about intracranial self-stimulation. So the rodent or the non-human primate, they can stimulate or push the liver several times to cause what? To cause a release of dopamine. So that helped in identification of dopamine as a major neurotransmitter in addiction research. And another one is the conditioned place preference. So before conditioning, the drug is introduced as an unconditioned stimulus, and it produces an unconditioned response to the drug. Now, this is the chamber for performing the conditioned place preference. In the towards the end of the session, we'll be seeing a video. I don't know whether the audio would be played. We'll just see. So this is a chamber, and you can see there is a color difference, there is a pattern difference, there could be auditory or olfactory, some differences would be there, or it could be a light chamber or a dark chamber, and this is the antechamber. What ideally should happen is the animal should move in either of this chamber equally. So before conditioning, this happens. Now what happens during conditioning? During conditioning, what happens? A drug is introduced in one of the neutral chambers, and what happens? After conditioning, the preference of the animal to stay in the conditioned chamber over the neutral chamber is assessed. So that is the condition place preference. Now imagine, instead of a drug that is causing addiction, you are going to give a dopamine antagonist to the animal. What will happen to the pressing of the liver or pushing of the liver? The animals will work to avoid or escape the administration of the dopamine antagonist. Why? Because the dopamine antagonist is blocking the high introduced by dopamine. Now, instead of this, if the drug is still being continued and you're giving a dopamine antagonist, what are you going to expect in this animal model? In this animal model, will it continue to press the liver, or will it stop the liver as in the previous case? Actually, in the initial phase, there will be a compensatory increase in the pushing of the liver. That is to increase the self-administration of the drug so as to block the effect caused by the dopamine antagonist. But eventually what happens, the dopamine antagonist level that is administered to another route, that is increased so much that the animal does not derive any pleasurable activity. So there is extinction and cessation of the self-administration. Okay. So these are the various animal models which showed that dopamine is really involved. Dopamine level is actually predictive of the high introduced in addiction. And the first injection of the addiction causing drug can cause up to 200% increase in the dopamine levels, especially in the nucleus accumbens. So real-time synaptic neurochemistry showed that with subsequent administration of the drug, there was a level of 100 to 200% in the nucleus accumbens. So what happens with subsequent use over long term? There would be a low or phasic dip, and this phasic dip is indicative of the next volitional self-drug administration. Okay, so we have covered the three models. Now coming to the next model. So the next model is a comparison between the moderate versus extended axis, or the limited versus the extended axis, or you can also call the short-term axis versus the long-term axis. So the main drugs tested were heroin, oxycodone, and fentanyl, especially by Ahmed and Koob in 1996. They also tried buprenorphine, but with variable result. So heroin, oxycodone, and fentanyl, they were administered to the animals. If it was limited access, it was for only 1 hour. And the extended access or the unlimited access was up to 6 hours. So what happened? Let us see in this graph. The white dot is showing the long-term access, and the black dot is showing the short-term access or the limited access. So in short-term access, you can see that the liver pressing is low and stable. Okay, the pushing of the liver or the pressing of the liver is low and stable. Whereas in unlimited access, there is an initial escalation of the liver pressing, and this is followed by a dose titration. This is the classical inverted U shape, and I couldn't see a classical inverted U shape, but all the references I referred showed that there is a classical inverted U shape in unlimited access. This is because of the titration of the dose. Okay, and coming to the next model, that is compulsive drug use. Now the person has had instinct for developing drug addiction. The person started using the drug, now the person has experienced that drug-induced high. Now he is going in for binging. Now that is compulsive drug use. We all know that addiction drugs, they come with harmful effect. The animal model here also knows that the drug is coming with a harmful effect. What is the harmful effect? There would be a pushing of the liver, there would be a visual cue, and what is happening? An electric shock would be delivered to the paw every time the drug is administered. So what happens if there is a harmful effect? We would stop it. But those who are prone to develop addiction, they won't stop it. So here, the persistence of responding for drug when drug delivery is associated with punishment refers to compulsive drug use. And the relapse models we'll be seeing again. And in such persons, there will be a propensity to relapse. So the animals, with the help of a visual cue as well as pushing of the liver, they are trained for self-administration of the drug for 3 months. Then what happens? There is extinction of the visual cue as well as delivery of the drug. It can be a short-term extinction for 5 days, or it could be a long-term extinction for 30 days. And then what happens? There would be a cue-induced reinstatement. So even after withdrawal of 30 days, if the animal starts a cue-induced reinstatement of pushing of liver, then it is suggestive of compulsive behavior. Excuse me. Sorry about that. So some animal models are high prone to relapse, and some animals, they have low relapse prone. Could others please mute? So we can see that in animals who are having high relapse prone or who are prone to develop relapse, the number of presses, even in the absence of actual drug delivery, would be higher. Here the number of presses is 300, but in animals which are prone for relapse, less prone for relapse, the number of presses is only 50. Okay, this could be also the model of a drug that could cause de-addiction and a drug that could cause addiction. In animals who are highly prone to relapse, there is a progressive increase and persistence of drug seeking during no drug or punishment. That is a cue-based reinstatement after a withdrawal period of 30 days. There will be a progressive increase or persistence. The number of presses have increased, and there will be resistance to punishment. Even though a food shock is delivered, they will try to continue pressing the liver for the drug, and there would be higher incentive or motivation for self-administration, and the higher breakpoint for drug self-administration under progressive ratio reinforcement. Progressive ratio reinforcement, if you remember, I already told, that is working more for getting that drug. So coming to the next step, that is the opponent process trap. Now a person, he has started binging and is on compulsive drug use, and then because of the adverse effect or because of the compulsion from friends or peer or family, what happens? They try to stop it, and what happens? Withdrawal process sets in. So a medial electrode placed in the circuits of the brain showed that initial injection of morphine at 10 milligram per kilogram resulted in a reward, that is an increase in the dopamine level. But with subsequent uses or more uses, what happened? There is a decline in the dopamine level. That is due to the tolerance developed. So there is a decrease in the brain reward. The drug enhanced reward dissipates. Okay, and what happens to the patient or the animal here? Instead of getting the drug induced high, it starts to get aversive phenomenon. Or in the case of a person who is addicted on morphine, what happens? Instead of getting euphoria, dysphoria sets in. And now what happens? An electrode that is placed in the lateral part of the circuit. It showed that there is an inhibition of the brain reward and there is a progression of this inhibition. That is, the drug-induced inhibition of brain reward increases. So as I already mentioned, instead of getting that positive effect, the animal or the person starts getting the negative effect of drug use, resulting in withdrawal. And the animal continues to take the drug or pushes the liver not to get the drug induced high but to get the drug induced state. That is, just to avoid the aversive effect of the drug, the animal continues to take the drug. Now this is different from the anti-reward state. Anti-reward state, that's because of a rebound phenomenon, because of the diminished dopamine in the nucleus accumbens, the stress, the negative emotions attached with drug use. So this is explained by Cook and Mole et al. And you can see here the substance dependence continues. And here you can see the positive reinforcement is no longer there. There is an increase in the negative reinforcement and there is intense motivation to escape the discomfort associated with withdrawal. So these are the models that are associated in that state, that the opponent process trapping as well as the anti-reward state. Now coming to the last models, others could you please mute? So coming to the last of the models, that is the relapse model, the extinction based model. The extinction based model, it could be an operant response extinction or a Pavlov response extinction, and it could be also abstinence based, that is a forced removal from the environment, or a voluntary removal that is induced by adverse consequences. Which of these would you think is more similar to that happening in the humans? It is not extinction based, it is abstinence based model, because human beings usually extinction based models in extinction based phase does not happen in the human. They voluntarily try to stop the drug use, or there is forced removal of the drug from the environment. In the case that is abstinence based model are more suggestive of that seen in the human beings. So here we can see here there would be also a video. So there is a self administration of the drug by pushing the liver, and there is a visual cue. Now in the extinction phase there is no visual cue and there is no delivery of the drug. And what happens in the relapse phase? The visual cue is there. There is no delivery of the drug, but the animal continues to push the liver. So could you please tell whether the audio?
Yes, ma'am. Yeah, ma'am.
I think this video cannot be played.
Okay.
Yeah. Can you hear the voice?
Not able to hear the voice, ma'am. Only picture is visible.
Yeah.
Ma'am, when you share this one, please include computer sound.
I will explain. Is that enough?
Ma'am, are you able to hear me, ma'am? When you share this slide or this audio, please include computer sound along with it, ma'am, so that we'll be able to hear.
Excuse me, ma'am. While seeing the audio, can I explain that? Is that enough?
Yeah, no problem, ma'am. Yeah, carry on.
Yeah. So there are three phases. We have already seen this. And in the self-administration phase, you can see what is going to happen. So the animal presses the liver. There is a visual cue, and what happens? The drug is delivered and it experiences a pleasurable effect. So the self-administration phase is done for about 3 months, and there will be repeated delivery of the drug over time. Every time the animal pushes the lever, there will be a visual cue as well as the experience of the animal, that is the pleasurable effect is got. Now the self-administered phase stops and next comes the second phase.
Pain, which is a chronic pain, it is mainly taken over by the sensitized.
So there are three phases. We have already seen this, and in the self-administration phase, you can see what is going to happen. So the animal presses the lever, there is a visual cue, and what happens? The drug is delivered and it experiences a pleasurable effect. So the self-administration phase is done for about 3 months, and there will be repeated delivery of the drug over time. Every time the animal pushes the lever, there will be a visual cue as well as the experience of the animal, that is the pleasurable effect is got. Now the self-administered phase stops and next comes the second phase. So the second phase is called the extinction. We have already seen the picture. Now, if you remember, in the extinction phase, what is not there? Neither the drug is there, nor the visual cue is there. The poor animal is going to push the lever, and neither the drug is delivered, nor the visual cue comes. Now, this could be for a short period, that is 5 days, or it could be for a longer period, 30 days. Now comes the third phase, and in the third phase, it is a cue based relapse challenge with a relapse cue. That is, we are going to reintroduce the light which was associated with drug delivery and the pushing of the lever. So now let's see what the animal does. So even though there is no drug delivery, whenever the visual cue occurs, the animal starts to press the lever, but the drug is not delivered. So the number of lever presses at the visual cue, that is an indicative of whether the drug, whether the animal is having a higher prone or higher predilection to develop a relapse, or whether the animal is less prone to develop a relapse. Similarly, we can also test medication. So if it is a drug that is effective for de-addiction, that would result in less number of presses as compared to a placebo. Okay, that's done with this video. Now, next is the condition place preference. This is a video on condition place preference. Already, this video is not having any audio. So the part 1 test, we have already seen the condition place preference. The rat is placed in the central chamber and allowed to explore freely, and a bias is indicated by greater than 25% difference of the time spent between each chamber. Ideally, it should be 50-50% each in the chamber. So you can see here there is a light chamber as well as the dark chamber. Usually the mice or the rat, they prefer the darker compartments over the lighter compartments, and the rat will naturally prefer the darker compartment and spending 25% more time in the dark than the light. Now, second is conditioning. If you remember the figure, the morphine is introduced in one of the chambers. Here they are introducing it in the light chamber, and eventually the rat or the mice, it starts to move towards the light chamber. The rat is given an injection of 10 milligram per kilogram morphine, and instead of the dark chamber, it starts to prefer the light chamber, which was initially adverse because of the connection with the drug intake. So multiple doses of the drug could be given, and after conditioning, the time spent in either of the chamber is calculated for finding the addiction possibility of that drug. So acquisition, the same procedure as the pretest is performed. The rat is allowed to explore freely for 30 minutes with greater than 25% difference between chambers, indicating an acquired condition preference. And the difference between the innate preference and the condition preference is the preference score, which is then used for data analysis. So the length of the time spent in the adverse chamber indicates the salience of the drug reward. Despite this being an adverse chamber, because of the rewarding action of the drug, the animal spends here. So variation on this model can be, maybe it is associated with a pushing of the liver, or it could be a genetic change in the mice. It could be a knockout mice that do not develop a preference for the adverse chamber due to genetic difference. Now, one more video is on the same thing, that is a condition place preference. We can see here, this is the antechamber, and there is a difference in the chamber in terms of the appearance. It could be a checkboard, or it could be a polka dot shaped chamber, or there could be olfactory administration of olfactory variations, or there could be a visual variations, and the preference of the animals in preferring the either the chamber. So you can see here, the initially the animal moves freely amongst either of the chamber. Now what happens? We are going to introduce a drug. And after the introduction of the drug, the animal is conditioned. And which chamber would it prefer? It would prefer the polka dotted chamber over this chamber. Okay. So coming to the last few slides, we know that the forward translation with these animal models is very less. As I already mentioned, only varenicline or naltrexone has come out as forward translation, and the positive predictive value also, that is the development of the drug, these models for the development of drug is very less. So certain research has tried to find out the drugs for de-addiction, especially the corticotropin releasing hormone receptor antagonist, corticotropin releasing factor receptor antagonist, cocaine vaccine, or certain 5-HT antagonists like locarcerin, or even drugs that modulate the glutamatergic pathway. These are being tried with the help of translational research, that is backward translation. From the drugs, we are trying to find out the animal models, and we could also develop genetically modulated rats using CRISPR or Cas, or use the involvement of various chemicals which lead to genetic modification in the animals, or light which could modify the genes, that is chemogenetics and optogenetics. So that's all. So to summarize, self-administration models, they are the paradigm for the research of addiction, and also the condition place preference, that is also important animal models. Ethanol abuse is associated with anxiety, and also so the models like forced swim test or the elevated plus maze could be used to assess the anxiety in such animals. We have to develop models which could be more relatable to human beings, like contingency based models or community reward response models. So once again, I thank the Department of Pharmacology of KMCH, and I also thank Shamsar for referring my name. So these are the acknowledgement. There are several ways in which animal models of addiction could be discussed. This session is mainly based on the article by Gardner et al. Okay, thank you.
Wait, ma'am, once again.
Ma'am, hope that was clear.
I guess the screen is visible, participants. We are thankful for that excellent and thought-provoking presentation on animal models for drug addiction. Hope to see you back on other scientific meets too, madam. Probably not a virtual one. Though it was a last presentation, it was in fact a blasting one, and we owe this certificate to you, ma'am. Thank you again.
Ma'am, thank you, Bhuvneshwari ma'am, and Department of Pharmacology, KMCH.